So hello everyone. In this video, we are going to address a number of questions that will work for all ENT aspirants across the world. Those who are confused whether to take ENT as a career option or not. We found that there is a popular exam called NEET PG and INICET in India. Hundreds of thousands of doctors appear there every year. And we found that a lot of envious doctors, they are rushing here and there in social media, as well as YouTube, regarding the choice of ENT seat selection. There seems to be some of the videos and content, but they are not actually addressing the actual quest of aspirants. They are not addressing their issues. Some of them, they are talking like politicians. Some of them are branding themselves. Some are sugarcoating. So, now here we present the details about the ENT branch as it is. We present as it is for the ENT aspirants in the Indian subcontinent conditions. Though it will help for ENT aspirants all over the world, but this is focused primarily for the ENT aspirants in the Indian subcontinent zones. Like India, Bangladesh, Pakistan, they have all kind of similar college conditions. So, as we move ahead. So these are the frequently asked questions by aspirants in different social media or YouTube. So we will address all these questions one by one. The first question is, my suitable candidate for this branch? And the answer is yes. The answer is yes, because there are no any prerequisites to become an ENT resident. In fact, there is no necessity for any form of predetermined interest or liking. As you move along this field, you slowly evolve to find the things of your interest and passion. So, every graduate with an MBBS degree, okay, they are suitable or eligible for this branch. Second, what kind of branch is ENT? Well, it's completely a surgical branch. So if your inner fulfillment as a doctor's, as if it comes from the sole prescription of tablets, capsules, injections, and you hate surgical procedures, you might feel that things to be different as you expected if you join this branch. Despite the fact that majority of the earnings in Indian subcontinent conditions, they comes from the OPD practice. Okay, but it is also a matter of consideration that you have dedicated 3 years of life for a field, the academic portion of which is entirely surgical based, right? So you have spent 3 years of life, to learn all the basics of those surgeries, and if you're not using any of this, then that will not turn to as a fulfillment. And even if you don't perform even a bare minimum amount of surgeries, when you don't perform that, then slowly in your private practice, the patients will start to feel that you are not a complete specialist. And it will happen because you will be repeatedly referring the patients. Okay. And also that because your peers, your colleagues, and even your juniors will be doing a lot of surgeries in the same town, as you said, a feeling of lagging behind, it may persist upon you. So, you'll have to be ready for surgery if you want to excel in this branch. Next question, what are the vital aspects of this branch? Well, it is a very diverse branch. Though ear, nose, and throat, and though they sound to be very small groups of organ, but when you enter into the field of ENT, you feel that they are in fact different sets of human beings as themselves. So, like joining ENT is like joining an MBBS or a medical course of different entity, and it's called ENT. Similarly, the surgical procedures, they are very diverse. Each surgery is a different game, and different rules are set for different surgeries. You have different sets of instruments, and different surgeries, their word is totally different. Okay. And the other vital side is that ENT is a self-sustaining specialty. A huge number of patients are there in ENT, and ENT receives a lot of interdepartmental consultations from the pediatrics, from the medicine, and so on. And most commonly what happens, typically in the Indian subcontinent zone, is that once we try to discourage, telling that there is not much of scope in the field, okay, like who will suit the ENT doctors, like medicine or other subject would be good. The patient or the persons would tell that, and slowly they will themselves land upon into you with the ENT problems by the time you reach second year, right? So a lot of ENT residents, they explain this kind of incident happening to them. The other practice side is that you can modify your practice the way you want. So whether you want to do a 10 major surgery a month or 100, it will completely depend upon the choice and the amount of opportunity that you'll get after post-graduation. Next, an interesting question. So how much of study is required during residency? Well, to be frank, a lot of study is required. From second year onwards, you will have to utilize every minute that you can manage even during the duty hours. Actually, nobody knows and thoughts that ENT resident rooms are the ones filled with largest number and volumes of books. Not only you have to read different books for ear, nose, and throat, you'll have to read multiple editions of the same book, right? You'll have to read the multiple editions of the same book. And while solving the past papers, you'll need to consult a minimum of 4 to 5 books to find answer for a single question. Right? So it's quite tough. Now choosing the college. Okay. As you know that there's a surgical subject. Okay, and this subject is ultimately the subject of hands-on surgical procedures. Okay, hands-on is ultimately what's important. Hands-on, mark my words, hands-on is ultimately the most important thing in ENT. Well, if you look at other videos and suggestions, that some say that patient flow, some say infrastructure, some say that academics, setups and all, they're actually not complete truth. Okay, so while choosing a college, what you should look upon is that what is the provision of the college that is set for the faculties of the department. You'll have to look, you'll have to try to find out what are the provisions set by the college for the faculties. Okay, are the faculties, are they committed? Okay, are they committed full time to the college? Or the college is allowing them to do a private practice? Believe me, this is the single must factor that will decide how much hands-on you'll get during your residency training. If they are doing private practices, they cannot devote time to teach you. They cannot teach you surgical skills because they'll have to rush to the private setups as soon as they finish the job in the hospital or the medical college. So they'll finish the cases quickly and run out to the respective private setups. And secondly, in some of the cities, some faculties, they feel quite a bit of insecurity to teach the surgical skills. Okay, they do not want their juniors to excel, and they'll think that if you learn all of the skill, and if you get somehow the chance to settle on the pace of the practice, it will reduce the patients, it will reduce the cases. Actually, there are lots of people who feel that way. People who are already on the field of ENT know exactly what the statement we stated meant, right? So is there a need for super specialization after PG? Actually, the advantage of ENT itself is a non-essentiality of a super specialization. Okay, ENT by itself is a self-sustaining branch, as we repeatedly say. And even after completion of post-graduation, there will be a lot of surgical skills that you need to work upon. It is not like that you will master everything by the end of PG. It is a lifelong adventure, it's a lifelong game. Yes, certainly there are attractive things like head and neck oncosurgery, skull-based surgery, plastic surgery. Yes, you can pursue them upon an interest. But how ahead will you go on this field? It will depend upon the opportunities that you will get, not the degrees of the specialization of the MCS courses themselves. Nobody will welcome you with an attractive salary once you finish super specialization or do MCS. The market works with different sets of algorithms. Okay, if you are a kind of person who can generate opportunity for yourself, the degree of MS ENT is itself more than enough. So why would you bother other 3 years in extra degrees is the question. So different sets of opportunities are there. So if you are very good in the field, then you'll be welcomed in different hospitals across the world. For an average graduates, okay, for the average graduates, MRCS ENT, every UK is one of the good opportunity. Similarly, in Dubai, you have DHC ENT exams. Similarly, for the Gulf countries, you have prometric ENT exams like Qatar Okay. And it's a ENT. Okay, MISENT. And a lot of doctors also work on the Maldives. Okay. These are all the options for airways ENT graduates. So, what are the drawbacks of this branch? Well, the major drawback is the lack of independence. Right from beginning, okay, from the instrument that you use, you are dependent on a lot of things. Different things like setups, anesthesiologist, audiologist, speech technicians, pathologist, radiologist, radio technicians, even some of those mechanics who can fix small kinds of things like repairing the suction machines or changing the bulbs of microscopes. Okay, you'll be dependent upon them. And one of the drawbacks of this branch is that you're actually nothing and nobody bare-handed. Okay, bare-handed you are nothing. The operating microscope, endoscopes, cameras, setups, all these are very expensive. Okay, so to arrange the setup, it is very costly process. And there are few other drawbacks, like in any surgical branches, they will see. Typically in the Indian Indian condition, the first year will be tough, especially in the hospitals like government hospitals or the public sectors where the staffs, they have permanent jobs. For example, housekeepers, logistic managers, technicians, okay, storekeepers, nurses, paramedic staffs of the department. Okay, if they are if they are a permanent staff of the department, they are the permanent kind of government employees. Okay, what they will do is that they will try to impose their work to the first year residents. They will try to act as some kind of authority. And there will be a lot of times when for example, the operation is over and you will be alone with the patient in the entire theater. You will have to shift and manage the patient around, right? So guys, hope that these key points will help you decide your career choice. If you have any questions, please drop it in the comment section. We'll try our best to provide the honest answer. Thank you.